Welcome back, everybody. Dr. Patrick Flaherty with the Arkansas Heart Hospital is here to share why cardiovascular screening is so important and also details on the hospital's Keep the Beat program. Doc, good morning to you. Thanks so much for coming in today.
Thanks for having me.
This is Heart Month. This is your month, really, isn't it? I mean, this is something you guys focus on and really try to get the word out and the awareness out.
That's correct. Turns out that every month is Heart Month.
Well, of course.
This one is just the month that gets all the attention,
Yes.
and we're happy to be here to talk about it.
So glad you could come and talk about this and really the importance of it. You know, you talk about screenings because the statistics are pretty clear and thorough. Whenever it comes to heart disease, it's the #1 killer, and it is something that affects men and women so far across the United States, and it doesn't get talked about enough, I feel like. So talk about why it's so important.
Well, that's an interesting point that you brought up, being as particularly for women, and with Go Red having happened and all of that, women are grossly underdiagnosed with coronary disease, and being able to utilize tools that you have at your disposal to try and raise the attention and raise the awareness of what may be impacting somebody's health is very nice to have. Using the tools that we have with the Keep the Beat program, it basically takes traditional screening and then puts on another layer of it for folks that are appropriate for it in terms of the screening with CT scans and those type of things for calcium scoring. Calcium scoring is something that's been used for decades for screening pilots in the military.
Really?
And out of the military programs, this was a natural evolution back in the 90s to look towards something that was a little bit more sophisticated than just yes or no, do you have coronary calcification? You can actually assign a score to it and thereby extrapolate a risk to it and add it to their traditional risk factors to try and make some sense out of it.
Let's talk about some of the things you would screen here. I see a lot of different letters, HDL, LDL. What does all this mean? What do you screen for?
A little bit of everything, but it's, overall you're looking for a risk. And so these numbers on an HDL, which is your good cholesterol, your LDL, which is your bad cholesterol, your hemoglobin A1C, which is basically an averaged look at your blood sugar levels over the course of a 3 to 6 month period. These are all things that if you look at them in a much more detailed fashion, they can get a little bit mind-boggling. But for folks in an introductory level, as far as looking at their screening and those type of things, we're trying to keep it as basic as we can. There's also something called C-reactive protein, which is a marker for vascular inflammation. It doesn't tell you the whole picture. It's just one more thing that you utilize in terms of adding up somebody's individual risk.
Let's talk about some of those scores. What should the numbers be because when someone gets their scores, maybe they're not sure of the scale that they're going to be on. Starting with cholesterol, for example, what's a good score? Generally
speaking, if you're looking at a primary care level type of thing, you're really just going to focus on your total cholesterol. And most times, if it's below 200 and you don't have a strong family risk to go looking for a lot of other fractionated components of the cholesterol, you're usually going to find that they're okay. Now, you can have some folks that have a really low HDL, which is your good cholesterol, so they could have a low total cholesterol under 200, but if it's because their HDL is only 15 or 20, they could actually be at a very, very high risk. So on the screen, you see the totals under 200, the triglycerides, which is kind of a marker for dietary fat, but it also goes pretty tightly with diabetes. And then your HDL levels, you really want to focus on those being over 50 if you can. And then the LDL cholesterol below 100 is a traditional number that we would look at really in secondary prevention for folks that are either diabetics or they have established coronary disease. But that number for below 100 is actually a pretty aggressive risk or a pretty aggressive number to look at. And so you'll see a lot of folks that are in that 100 to 130 or 150 range that are actually generally okay. But if their risk warrants, you got to go a little bit below the 100 mark.
Now, to get a screening, it's pretty simple. In fact, there's an event that you can take part in. For more information, 501-219-7283. It is Keep the Beat, and they're going to take great care of you over there at the Arkansas Heart Hospital, keeping your beat going, Doc. Thanks so much for coming in today. Appreciate it.
Thanks for chatting with me.
And a great point, by the way. Today, or this month might be Heart Month, but it should be Heart Month every month. Take care of it. Hey, coming up next, we're going to share some